Today we are having a talk on AI and its applications in healthcare by Mr. Sanjay Churiwala. Just to give a brief introduction, he is an electronics and electrical communication engineer from IIT Kharagpur, and he has been working in the field of semiconductors for more than 3 decades. He has co-authored multiple technical books, including Introduction to Machine Learning, which was published by Springer Publications. He's also written several newspaper articles related to career, including one on AI in Times of India. And currently, he's the corporate vice president in the AMD at Hyderabad office, and he's working in Adaptive, Embedded, and AI Intelligence Group. So he's going to give us a brief overview on what is AI and how we can use AI for healthcare. And following this, there will be a talk by Dr. Sara, a pathologist, on the hematological applications of AI. Thank you, Sanjay sir. Please.
So I have been to AIG Hospital many times, this branch, and also mostly I come patients who come from my hometown, Calcutta. Okay, this is probably the first time I'm coming here in a mode that is less strenuous on me, accompanying any patient. So AI itself is highly mathematical topic. There are a lot of mathematics involved in it. But given that we are talking to medical community, we'll try not to do too much of mathematics. We'll try to leave mathematics out of the whole thing. But we'll try to get a feel of it, right? 20-30 minutes is too small a time to cover a topic like AI, right? Even for introduction, it's a very small time. So today we'll just see what kind of things are potentially possible. We'll not be able to go into the depth of anything, right? Just very, very superficial. Also, what I understand is AIG has been having several workshops and or whatever around AI. So I don't even know the level or extent of expertise already available, right? So that was much more difficult for me to figure out what level to talk at, right? So in case you want for future conversations, you could let me know which areas to go into depth, the level of depth that we should and we should not kind of thing. That will help us for future. So for now, let's see for next 25 minutes or so, we'll try to do a little bit of feel of what AI is. There are two places where I'll request you to suggest something, and please feel free to suggest, right? That will maybe give us help us get a feel. So so these are few topics we'll cover, right? But each of these will just touch and move, right? So first, how does ML work? Okay, AI, machine learning. AI stands for artificial intelligence. Machine learning, ML is machine learning. The boundary between these two is not very clear, so we can use it interchangeably to some extent. Typically, people want to say AI is the more advanced version compared to machine learning. So the fundamental premise of AI or machine learning is that given a certain relationship, identify that relationship, okay, and do it iteratively. Okay, so there's a fundamental premise on which the whole concept of AI works. There's a relationship exists and identify that iteratively, right? That is very important. It does it iteratively. So to get a feel of it, let's look at a very simple problem, okay, and we'll see how can we solve it iteratively, right? The problem that we'll choose, that I have chosen, is something that we can solve even without iteration, but to get a feel of how do things work iteratively, right? So let's say I have to find the square root of a number, okay? Square root of a number, let's say 100. I need to find the square root of 100. And I do not know how to find the square root. I know what square root means, I know its concept, etc., but I do not know the mechanism of finding the square root. So I have to find the square root of 100. So any suggestion on how can I do it iteratively? Okay. So any suggestion? No suggestion at all? Sorry? So 4 into 25 is 100. We are trying to find the square root, right? Oh, so you have done the factorization, right? So this is a correct answer, but I was trying to go more towards the iterative method, right? So instead of 100, let's say if it was, say, some other number where this factorization may not be easily possible. Right? So I was trying to look for an iterative method. And there are multiple iterative methods, right? But can you think of any one iterative method? Great, right? So I'll try 1 into 1. I have not reached 100. So then next thing I should do is 2 is square, right? Square of 2. I did not reach there. Next thing I should do is till after 2. Till 3 square, 4 square, 5 square, and at some state I will reach 100, right? Or the answer is 10. So this is a valid answer, right? This is a valid mechanism. This is a good way to find the solution of square root of 100. Okay. So this same thing, whatever you just said, could be considered as ML in one way. Okay. So what is ML? You start with some guess and then gradually iterate, and then till you reach the final answer, right? Now you started with 1. Why 1? Why didn't you start with 7? Right? Just somewhere. That's okay. That is somewhere, right? So 1 is also valid. I could have started with 7. Instead of 100, if the number was 64 lakhs, right? How many efforts, how many attempts will you take, right? You will go 1, 2, 3, 4 and so on, right? So I can use another property of square root, okay? The property that you used is the number multiplied by itself becomes 100, right? That's the property that you used. I can use another property for square root, which is I will divide that number by my guess, right? I'll divide that number by my guess. And the quotient should be same as my guess if I reach my square root, okay? So I divide the number 100 by 1, quotient is 100, so it is not the right guess. I need to update my guess going towards the quotient. So I should pick up a number which is between 1 and 100. I could put 5. Now the quotient will be 20. So I need to go further towards 20. I could go to 8. Now the quotient is something like 12 point something. Now I need to go further and so on, right? So this is also iterative approach. My approach is also iterative approach. The fundamental difference is in my approach. Let's say my guess has 9. I have reached till 9. Let's say I have reached till 9. Okay. The quotient will be now 11. Okay. So it tells that I have reached very close. Right. From 9 to 11, the difference is not very high. I have reached very close. In the previous approach, if your guess was 9, after squaring you will reach 81. Okay. You are still 19 away. You don't get a feel that you have reached very close. So that's one fundamental difference, right, in my approach. The second difference is in your approach. Let's say if somebody had started with -5, okay, -5 is also a valid number. You will go from -5 to -4 to -3 and so on towards 10, right? While once you are at -5, it is much easier to reach to -10, which is also a valid answer, right? So when we talk about ML, first aspect was the iteratively reaching at a solution. The second aspect is define your problem properly, okay? If we define our problem, if we understand certain characteristics of the problem space, we can define our problem slightly differently, and that will help us take much more intelligent guess for the next iteration. Okay. So instead of 1 to 2 to 3, right? If I start with 1 and the quotient is 100, I can take a much bigger guess. Okay. From 1, go to 7, go to 5, because the difference is much higher. Okay. And the direction of the guess should also be intelligent. Okay. If my guess was -5, the quotient comes out to -20, so I'd go towards -20. Okay. So I'll reach -10 faster compared to reaching 10. So the idea is when you are talking about machine learning, two things we figured out. One is iterative solution, and the second is formulate the problem in a manner that the direction of next guess becomes easier and the size of jump is a bit more intelligent, right? Rather than going 1, 2, 3, 4, I can sometimes make bigger jump, sometimes make smaller jump. When I have reached closer to the solution, I should make smaller jump. When I'm far from the solution, I should make bigger jump, right? So at any given time, you should also get an indication of how far are we from the solution. That's also important. So machine learning recently became much more interesting, more because of ChatGPT. Okay, ChatGPT, and the reason why ChatGPT became popular is very similar to say Facebook. A lot of teenagers went into it. Okay, that's why people use it to write their essays. Students use it to write their essays, and so ChatGPT and so on. But the idea of machine learning became popular from the world of image recognition. Okay, image recognition as a topic has been under research and teaching, at least in engineering, since 90s for sure, right? I graduated in 93, and during that time frame also computer vision image recognition was taught to us. But in between, that image recognition concept somehow died down. 2012, some research paper again got published which shows that image recognition works well, right? Between that time frame till 2012, people had given up on the possibility of image recognition. 2012, once again, AI ML became very popular because once again it was determined or shown that image recognition can work. There are a few other things which played a role, but that was the main thing. Image recognition works on a technique called CNN, Convolutional Neural Network. CNN, Convolutional Neural Network. And convolutional neural network is built on top of neural network itself. Okay. And this image recognition has application in many domain. Okay, any domain you think of in machine learning area, it is an application, right? Started with ADAS, autonomous driving assistance system, right? So that was another area which generated a lot of interest on machine learning. Security and surveillance. You are looking at a camera is recording all those things instead of a security guy seated and monitoring all those cameras. If image recognition, pattern recognitions can identify something is going wrong and so on. And medical is also one area where image recognition plays a huge potential. Okay. Now, what is image recognition? So I make a statement that this is a bottle, right? Anybody wants to disagree? This does look like a bottle, right? Even a 6-7 years old kid will agree that this is a bottle, right? No. So what's the big deal, right? Why is it so important that neural network, convolutional neural network, machine learning, artificial intelligence, all those big things, right? They can identify this as a bottle. What's the big deal? So anybody here can say why on or what basis do we say that this is a bottle? So one answer is obvious. Its basic shape shows that it's a bottle. This answer is very, very obvious. Basic shape shows a bottle, right? But what in the shape? Exactly what is in this shape that is showing it as a bottle? If you have to explain to your kid, 3-year-old kid, that this is how you identify something as a bottle, right? What will you explain? What is there in this shape? Some few characteristics of that shape that identify that this is a bottle. Any few characteristics? Sorry? Made of glass. Oh, that's okay, right? So that's the purpose of the bottle. How did you recognize that this is a bottle? What characteristics in this picture did you use to recognize that this is a bottle? Hold on, one by one, right? So elongated is good. Elongated shape, cylindrical shape, and tapering towards the cap, good. And there was another mention of cap. There's a cap, right? And bottom and top is what? Bottom is closed, top is closed, right? So let's say 5 characteristics, right? Elongated, cylindrical, there's a cap, and what? Bottom is wider than and the top is narrower and closed from bottom and top, right? 5 characteristics. And condition or condition? All these characteristics should be present or any one of these should be present? Yeah, please. So what out of these 5 conditions, if you have to teach your nephew, right? If you have to teach your nephew that this is how you recognize your bottle, what will you say? You to mention 5 conditions, right? Any of these 5 conditions present, that becomes a bottle, or any one condition present, that becomes a bottle? More of those conditions should be present, right? Out of 5, at least 3 should be present. Then, right? Or we could say at least 4 should represent, then becomes a bottle. Let's look at some more bottles. Okay. Pick any one figure. Sorry, it didn't. Okay. Pick any one figure that you want and see whether it is matching all the conditions that you mentioned. Okay. This guy is cylindrical but not elongated, it is lying. This guy has no cap. Okay. There's no way, it's not even open at the top. Okay. But these are all bottom. Okay. Can't even see a lot of portion, right? But this is the bottom. So the conditions that we all mentioned, right? It was not necessary that they were really required, but still we could say. Okay. Let's look at some more things. These are non-bottles. Okay. But this satisfies several conditions that we discussed, right? Elongated, cylindrical, has a cap, closed at top, bottom, right? Multiple things. So what is so very obvious to us, okay, for a computer is not that obvious. But the bigger thing is, some of these we can even debate, which of these is a bottle, which of these is not even a bottle, right? That's okay, right? This guy, these are more of a jar than bottle, okay, but that's okay, right? The point is that this concept of image recognition was able to establish something very profound, okay? That neural network can identify very complex patterns and rules. Okay. Something very complex. It has to have condition 1 and 2 or condition 3 and 5 or 6. If 7 is present, then 8 has to be absent. If 9 is there, then 10 also has to be there, right? All those kind of conditions it can extract. Okay. To the extent that we as human beings may not even be aware of those conditions and rules, okay, or may not even be able to enumerate, right? If we were able to enumerate that for identifying a bottle, these are all the conditions, including as complex as we want, we could write a code for it, okay. But neural network established the possibility, gave a proof that certain conditions, certain patterns, certain rules that exist which are not known to us, that it can extract. Okay. That was the fundamental thing. That's why it was profound. Okay. Not because it can identify objects. Okay. Identify objects even I can do. But it can identify rules that I don't know that exist. Okay. So that was the fundamental main thing that artificial intelligence or machine learning or neural network brought in. So now that we understand this, what is it that we can do with it? Okay. So AI can establish complex relationship. That's one important thing. It can establish complex relationship and can identify non-obvious and hidden patterns. Okay. The pattern may not be obvious to us. We may not know why do we identify something as a bottle. What are the patterns in all these various figures? What is common in that? We may not know ourselves what is common in that, right? But AI or neural network specifically will be able to extract that, bring it out. Over here you see some car, I think there's a man here, there are some tires here and so on, right? So this is just an idea of to show that there are several objects which are hidden, but it can be extracted out by neural network, which we may not be able to do easily. So what kind of applications can we think of in medical world, right? The reason why I requested for this talk, right? So this talk, I was the one who reached out to Dr. Anuradha saying I want to at least explain a little bit about machine learning. And the reason I explained this was, there was a session here in December where a lot of people were talking about ChatGPT, how ChatGPT can be used to diagnose patients and prescribe medicines and all those things, right? I spent 90% plus of my time in a very close by area, right? More than 90% of my time is spent in a radius of 3 kilometers from this hospital, right? If something were to happen, most likely I'll be brought over here. I didn't want the doctors here to treat me through ChatGPT. Okay. So that was my main motivation, to at least explain, right? On the other hand, there's all this interest that we should use machine learning, we should use AI, else will be left behind, right? So at least wanted to explain what is other possible applications in medical side. And again, I cannot say that I'll cover all the topics, but at least some of the more profound ones. There might be others also, right? I'm not from medical world. So one is administrative activities, okay, chatbot kind of thing. When you reach out to a bank, you send a WhatsApp message on hi, it says, okay, what do you want, right? You say bank balance, right? It gives you balance, right? So that chatbot kind of thing, your routine administrative things, okay. So let's ignore that for now. It is more useful for people who are managing your front desk and so on. The most common usage at this time, the most common usage in medical world at this time is this one. To interpret a medical report, to interpret an imaging report, especially imaging report, right? Understand that AI and neural network can do a good job in identifying objects. So interpretation of imaging report is something that is where AI in medical care is being used much more often than anywhere else. Okay. Now, does it mean that we cannot do it? So I cannot do it, obviously, but does it mean that you all cannot do it, right? You all can also do it. Then why use machine learning or neural network for it? So it's a simple problem, right? Lots of M's identify there's an N over here. There's a one N hidden inside this, okay? You think the problem is complex? Identifying one N within this set of M's, is it a very difficult problem? The problem is not very difficult. You go through very patiently one by one, and you'll be able to identify an N somewhere over here, okay? But if I make this much bigger, you will not be able to identify. Why? It's not because the problem is difficult. Because we don't have the patience to go through it one by one, each character by each character by each character, right? So we get bored, okay? A computer will not get bored. To tell it to read 1000 X-rays, it will read 1000 X-rays with the same enthusiasm or lack of enthusiasm, whatever, right? We will not. We'll read 10, 12, 15. After that, okay. So medical diagnostic image report interpretation, that's one area where this is this machine learning is important or is getting interest. Personalized treatment, we can talk about it some other day, right? So this one goes more by what you had talked, Dr. Nitin, right? Linear regression and those kind of things, right? That can be used for personalized treatment. We can talk some other time. This is another interesting area where it can be used. Okay, identify a non-obvious relationship. Okay. Can an ECG report indicate presence of high sugar level? So far, we did not know that such a relation exists or doesn't exist. We talk about somebody who smokes is more likely to get lung cancer, right? Somebody observed that after seeing many patients, then they come to this conclusion, right? There are many such relations which exist which we are not aware of. Now, neural network can extract those kind of relationships. So, identify a non-obvious relationship. Can retina scan indicate cardiac problem? Okay. Usually we would think it cannot, but maybe it can, right? So if there's a relationship, non-obvious relationship, machine learning or artificial intelligence can help extract that. Can a report today predict problem that will happen tomorrow, right? There's a very famous book these days called Outlive. I don't know how many of you have heard of this book, Outlive, right? That Outlive book, the doctor talks a lot about the presence of a gene marker detected at the age of 30, which can point out the possibility of dementia at the age of 70. Okay. So these kind of patterns identification again can happen through machine learning neural network kind of. So this is less for treatment, right? But this right now, but this is more for research area, right? You can use this kind of machine learning to do some research. Okay. To identify patterns which are not known so far. So these are the few quick applications that I thought in terms of machine learning. Let's. So what's the biggest risk in all these things? If you decide to use medical AI for medical purpose, what's the biggest risk? You thought? Biggest risk. Responsibility and liability, right? Biggest risk is it will identify patterns when no meaningful patterns exist. Okay. The report which says the number of films in a year that Nicholas Kappa acted in and how it's related to the number of deaths by drowning. Okay. How many people drowned in a year is related to the number of films that Nicolas Cage or Nicolas Capa acted in. Machine learning will identify that relationship. Okay. So this is the biggest risk. It will identify a relationship when it does not exist. Okay. Give it a report and it will say if the patient's identification number ends with an even number, he is more likely to be diabetic. It will create that relation. So that's the biggest risk. When you are using neural network, machine learning kind of thing, please understand its job is to identify hidden patterns and it will bring patterns. Okay. When there may not be any meaningful pattern. So how do you deal with it? Train it on a large number of data. You give a patient, one patient data, found to be diabetic, that patient's this record number had 6 at the end. The machine learning can say any patient with 6 at the end can be diabetic. Okay. Or it can say any patient with an even number at the end can be diabetic. Or it can say any patient with number greater than 5 could be diabetic, right? You have to feed in lots of data so that it says that, sees that, okay, 6 is not necessarily an important characteristic. And then cross validate. Once it has identified a pattern, then cross validate. Okay. Usually we say that if you are using 60 data to train something, cross validate the result on another 40 data. Okay, not on the same 60 data. You have 100 data with you, use it 60 to train and then cross validate on 40. Then there are some of the other concerns, like these are more into ethical, legal side of things. I'm not going. I'm just talking about from the medical perspective. You will identify patterns that don't make sense at all. You cannot rely totally on machine learning. You need to have a large data set. Okay. Why? Because first of all, you have to train on a large data set, and then you need another large data set to cross validate. So you need to have first access to a large data set. We should cover both positive and negative cases. If you give it all the list of all the bottles, right, it will think anything is a bottle. You have to also tell, by the way, these are not bottles, so that it knows that everything cylinder is not a bottle. You have to give it a lot of positive and negative cases, and each data will fine tune the algorithm. And this is a cartoon, but this is a reality. Not come out clearly. What this says is machine learning gave you an answer, and that answer could be incorrect. So make another attempt. Keep making another attempt till you get a better answer. That's what this cartoon is saying. You can use the same set of data and different runs, you can get different answers. So this was just to tell on the large data. The other important thing is the data has to be digitized. Okay? So you got all these images, right? All these bottles, right? But there has to be a digital form of data for the computer to process. Unless there's a digital form of data, how can you process it? So what does it mean by digitization of data? So this is an image, right? Not much is clear, but I took a small snapshot. This is the table. How can you digitize this image? So this is a digital version of a portion of this image. I copied this from one of my books. A bunch of numbers. How does it even correlate with this image? So what I have done is I have drawn the boundary around relatively larger numbers, right? 150, 170, 200 kind of thing. Now if you look at this boundary, this is very similar to this portion of the image. There's a small bluish thing here, there's the notch here. So small portion of the image is what we have captured over here, right? So the way we have created the digital version of this data is the intensity of each pixel, what has been captured in terms of the number. Okay. So you need to figure out a way to digitize the data so that you can do some processing. Once you have the numbers, now computers are good at it, right? They cannot deal much with the image itself. Okay. Another one, we talk about strings, right? Statements, ChatGPT, etc. How are they, or the predictive text, right? How are they digitizing? Think of a system where each character has been given a number. Each character that you can type has been given a number. Capital A is one number, lowercase a is another number, B, C, D, full stop, comma, punctuation, question mark, everything has been given a number. Now, any word or sentence I can write as a sequence of numbers, right? So I have digitized my sentence. I have digitized. We have heard of something called large language model that has extended the concept slightly. Look at it. You read the whole dictionary to it, okay. And each word in the dictionary has gotten a number. You gave a number to each word in the dictionary. Now a sentence, how are you, can be written as 3023, 207, so on, right? So that sentence or the paragraph has been interpreted as a set of numbers, right? So this is what I mean by digitization. Okay. So I've come to the end of it, right? I think I've taken a bit longer also. The main point is creative learning is important. A lot of data points are important. Right problem formulation is important. Cannot depend on the answer that comes straight out of your machine learning data unless you have trained it on a very large number of data and cross-validated. It can bring out patterns which are absolutely meant. Please use your own judgment first before deciding to use all this weird kind of Nicholas Kappa influencing the number of deaths. And you have to look at digitizing the. Only then we can make. That's what I wanted to do for the first time. For subsequent sessions, if the in which I come more into how does it identify. Thanks. I think next one is right. 60-40 is what I said, yeah.
Training versus
So that's what 3:2. 3:2.
Usual, I guess. What is your view on that?
There are many publications which have trained data on 70 or 80 and tested it, meaning 20-30%. So that's what she's.
So I think I understood this one, right? So you'll see certain literature which talks about, say, 20, 20, 60, okay, 70, 30, and all those. There are all kinds of numbers, okay. So there are certain modeling parameters, okay. What should be your model? For that, you train it on a smaller number of things, right? Then you, once you have figured your number of modeling parameters and what should be your modeling parameters, right? After that, 60-40 is usually a good number, right? So you are also dealing with patients, okay. A small mistake at your end could be very difficult. So it can depend on the application also. If you are going to do something where you are saying that, okay, I'll use the machine learning for the first cut diagnosis, okay, and the second inference has to be done by the doctor, and the first cut diagnosis has to be more erroneous towards detect positive, okay. So in that case, you are okay to make some mistakes, right? If it is doing some false positives, that's okay. So there you can take a bit higher risk. Okay. So it depends on the application. 60-40 is standard, but like you said, 80-20, 70-30, all those are valid numbers. There is no definite rule that 60-40 is the only correct, but that is to give an indication that once you have trained your data, validate it on a good sizable number, not on 1 or 2 samples. We also say that if you have 100 data, you trained on 60 and you validated on 40, right? Now, once again, mix this 100. Okay, pick another 60 randomly, train again and validate on the other 40. Okay, now you got another answer. Mix again pick another 60. Okay, from the same set. So each time you are picking a different set and you are getting a different answers. Right? So it all depends on how critical is your mission. Yes, sir.
So this AI, how it's going to affect in future the man's thinking, creativity skill and thinking skill?
So ma'am, I have zero answer to this one. Okay, some neurophysicians probably may be able to answer, but I am very sure this is not the first time this kind of discussion is started. Okay, The day man moved to paper and pencil, that time also somebody would have said this. Because you are using now paper and pencil, your brain capacity is going down. I'm very sure, right? I was not there at that time in this world, but I am very sure that discussion would have happened at that time also, right? So it is highly possible that certain skills will probably reduce, certain other skills may probably increase, right? One of my bosses, she was in US, she was very, very impressed because 144 divided by 4, right? And I could just answer like that, okay? She was amazed, okay? Because she grew up in US, she studied in US, she was more used to calculator style, right? 144 divided by 4, a 24-year-old guy doing just like that was unimaginable for her, right? So they lost certain skill on that side, right? So how will it affect? I do not know. Definitely certain faculties will go down, certain others may potentially increase. But this discussion would have happened many times in many different ways, right? When you move from hand-drawn cart to horse-drawn cart, right? Your some muscles probably got weaker, right? When you moved from not bringing the pail of bucket of water from your grounds to chapakal to top floor versus this pipe water, again some faculties got weak, right? So something will happen. I do not know exactly which one. Yeah, ma'am.
Said when you are mixing the ratio, see, one set is 60-40, and then again you said you mix, you change another training set and test set separate 60-40. You said the results change.
Yes.
Suppose I'm looking for a, say, biomarker. I look for a biomarker in some blood or urine, whatever, fluid, some body fluid. Okay? If the markers change, the results change, how will I depend on the result? I want to see one marker or two markers. I don't want to see different markers. Then there is no point in using that at all. How do you answer this
So,
question?
ma'am, what happens is we always say that when you're talking about ML algorithms, you have to identify your key results indicator. Okay. How do you decide this result is better than that result? The results change, but which result is better? Okay. Once you have figured out of these options which result is better, you have to go with that. You have to do multiple times. Out of that, pick the one which gives you the best result.
Okay, thank you.
Okay, thank you very much.
Thank you. That was excellent insight into the basics. Now I welcome Dr. Sara Razak, our consultant hematopathologist, to give a few brief introduction on the role of AI in hematology.
I would like to thank Dr. G.B. Rao sir, Nageshwar Reddy sir, and Anuradha madam for giving me this opportunity to speak, to be a part of this session and to speak about the applications of AI in hematology. There are various applications actually in the pathology, but today I'll be just restricting my talk to the hematology. So this is my outline of today's talk. So first we'll see why there's a need of AI in the hemat, and just we'll have a brief look how exactly it works using the image analytics and how the AI will help in the diagnosis of various disorders of the RBCs, WBCs, platelets, and the cancers, blood cancers, and also in the molecular genetics. So in the first place, why there's a need of AI in hematology? See, hematology is a very challenging branch, which it needs very skilled professionals to detect the cancer, blood cancers. Like for example, if we take the CBP, a simple test, this is the first step to identify the blood cancers in the blood. So In most of the cases, if the blast is more than 20% or 10%, it will be very easy to detect on the smears. But in few cases like MRD or a very few percentage of blast, like 2 to 3%, then it is a challenging task to detect those cells on the smear. And if the person is not skilled or experienced, then there are every chances of missing the diagnosis. And likewise, in the bone marrow aspirate slides also, each case we have to screen 7 to 10 slides to give the percentage of the blast. So if the AI is there, then it definitely helps. It assists the hematologist to, it makes the work easier and screening and also for the early diagnosis. And with AI, the accuracy will increase, the productivity will increase, and also the TAT, the turnaround time will decrease, and it gives the quality to the patient. So this is just a basic model how the AI will work using the image analysis. So I will not go in detail how it exactly works with the neural networks and all that. I'll just say it uses the single image technique, and it will project the abnormal cells. So I'll just share a few examples. Like, see this slide, you can see this is how we see in the microscope, manual microscope. So if we have to look for the spherocytes, it's very difficult to see in so many cells. But what AI does is when we click on spherocytes, it will just highlight those cells. So making our work very easy. Then coming to the target cells. So when we click target cells, it will highlight the target cells. And target cells, when we see on the slides, it's very important to pick those target cells because we need to differentiate the iron deficiency anemia versus the thalassemia. So if it is more, then we have to definitely go for the further workup, like we have to go for the HPLC and all that. Then coming to the sickle cells. See how beautifully it is highlighting the sickle cells. One human eye is very difficult actually to look among all those RBCs to pick 1 or 2% of sickle cells. It not only highlights the sickle cells, but also it gives the percentages to categorize the severity, whether it is mild, moderate, or severe. Now, cystocytes. Cystocytes also is very important because we will see in the hemolytic anemias. And there also we have to give the percentage. So it's beautifully, it is just categorizing, and as well as simultaneously it will give the percentage of cells in the smear. Elliptocytosis. Elliptocytosis is also the cutoff is 25%. If you are seeing more than 25% on the slide, then you have to give it as a elliptocytosis. Then when it comes to the blood cancers, the AI, it assists in identifying the blast. It not only categorizes the different WBC cells, but also it gives us a percentage of blast and the precursors. Acute promyelocytic leukemia, it is an emergency. Thereby, pathologist has to inform the clinicians as early as possible because if it gets delayed, then the prognosis will get affected. So it just highlights and also it enhances the morphology. Therein we can see this aurors also in the blast promyelocytes. There is one paper group which studied about they categorized the atypical lymphoma cells on the peripheral blood using the image analysis. And when they compared with the manual microscopy flow with the AI, the accuracy was just lying between 94 to 99 percentile, which is acceptable. This is just a basic model how the AI will assist in the flow. So usually after adding the markers to the sample, we'll go by the plotting and gating, what we do in the flow cytometry. But the AI, with the help of the AI, all this, we can bypass the gating and plotting. Directly, the machine will give you the antigen expression values in numerical values, thereby giving the diagnosis. But again, after AI gives the diagnosis, it is the expert who will release the final evaluation will be done by the expert. Likewise, the AI will also help in the chromosomal banding and genetic profiling by using the image analysis. So what are the challenges of AI when it comes to implementing in the lab? First of all, it is very expensive and it always needs human surveillance, and it requires large set of good quality data inputs. So the conclusion is AI-based analyzer assists the hematologist right from the diagnostic prediction of the peripheral blood analysis to the treatment according to the gene profiling analysis. And it is better, faster, more precise healthcare to the patients. Thank you. Any questions? Yes, ma'am. I think right now it's a flow cytometry area because in a hospital where the oncology is growing so fast, we got so many patients on chemo with MRD. So the patients with the MRD is very difficult you to see on the peripheral smear because the blast will be less than 2%. So that's why we rely on the flow cytometry. But if the AI comes in that area, definitely it will be a very good help. And apart from that, the T cell lymphomas, it's very difficult to diagnose on the flow. So maybe in near future, it will help AI in the flow cytometry. Because still the lot of work has to be done in that area. Only few studies are available.
And also, I think it's more important in the immature granulocyte things, because what I feel is the immature granulocytes are in the series of maturation. So if we don't feed the machine with a different series of maturation levels, so as sir has said, what it knows is what it's going to predict.
Yes.
But if we don't feed it with all the different stages of immature granulocytes, it may even miss. So
Yes.
it might identify a reactive small lymphocyte to a small blast.
After all,
So
that
I
is
still think that the morphological eye, I mean, the human eye has to feed in more information before the AI. But definitely, as you said, in case when the number of blasts are less
Yes.
or wherever it is, it's definitely helpful because it's going to reduce our screening time, and definitely agree on that. Any questions?
According to you, what do you think which is better, AI or human eye, skilled human eye?
I feel experienced human eye is better than the AI because AI is the screening tool. We cannot just rely on the AI for the diagnosis. It always needs the human supervision before giving the diagnosis. It helps in the screening, not ultimately it is the human who will release the report. And AI in near future will never replace the hematologists or clinicians. It will just assist them in the diagnosis. Anything? Yes. Any more questions?
We also have Mr. Venkat Sudhakar Simatri here with us, who's the CEO of ASIP and Powerix. Sir, can you please give it?
Actually, you have a very visionary doctor, Dr. G. Ragar. Is he here or left? We should give him an opportunity. But Sanjay, right? Sanjay and me, we've been industry colleagues for last 5 years. We both conducted this VLSI conference, but I never knew you are such a good teacher. A good professor can make the subject so complex, right? And he can put you to sleep or get bored. But the way he explained the fundamentals, I'm really, really impressed. Thank you so much on behalf of AIG. And also he came forward and he's offering a series of lessons, sessions to teach AI and machine learning. And I'm telling you, AI will become a common basic subject for either engineer, doctors, lawyers, finance guys. Everywhere it is going to find applications. I strongly encourage all of you to go through those sessions. And of course, he's going to have a test in the end. and you have to make sure you do well in the test and he'll give you a certificate. Right, Sanjay? So give him a big round of applause. Thank you so much, Sanjay. Thank you.
Thank you so much, sir, for coming. Thank you. And we look forward to have you here. We'll chalk out the program and we'll get back to you. Thank you so much for that.